Hi, I'm Sean Young. I'm a GP working to the north of Bridgend. I'm in the Staying Healthy work stream.
Okay. And can you tell me a little bit about what your work stream is looking at? What are the issues?
Well, initially we were thinking that current model of health is basically very much based on provision of medical care. We're too ready to give people medical labels, making people less resilient and less able to look after themselves. We've got other elements of the service like housing, etc., which is pushing patients in to get a medical label just to enable them to access things like more better housing, etc. So we've got this whole industry sort of which is making people have medical labels, whereas really we should be empowering them as individuals to self-care and manage themselves and be resilient and not rely on medical services. There are obviously communities which generate a lot of the work, where the sort of communities themselves actually sort of perpetuate the circle of that unhealthy sort of model, with young mothers having children at an early age who then go through that same vicious cycle. They start smoking at young ages, they've got unhealthy lifestyles, they develop health problems early on in their life and then become our sort of medical statistics further down the line. And there are communities where that is an ongoing issue, and how you get into those communities and enable things to change around and a positive health culture to be developed is certainly going to be challenging. There's a need to move some resource around the system, because you will need to put some investment into this probably before you're able to pull out at other sort of bits of the system. There's also cultural issues. As I say, we're very readily giving people labels or trying to put them through a medical process when they don't actually need to. We need to build up better sort of routes of access to alternative services, so other methods of helping to support individuals to be healthy. We need to give them healthy options in the community, make access to sports facilities, access to healthy options in terms of eating in restaurants, etc., more readily available, provide good health information in our libraries, etc., so that people are able to go in and pick up a book which will tell them how to look after themselves and make themselves mentally fit and able.
So the emphasis is on keeping them healthy and ensuring...
And enabling them and supporting them to maintain that themselves without actually needing to resort to the medical model to support that, looking at what else is out there in the community to enable them to support themselves without actually becoming a patient, essentially.